Narcotics, opiates, and the drug addiction problem. This is Dr. Kevin Trangle here to talk to you about an issue that is prevalent in the workplace as well as, more importantly, in society in general. I would like to share with you just a short approach to how we take care of people that have opiate addictions. My background is dealing in substance abuse as medical director of a rehabilitation company for the last 15 years. I go back probably 30 years as FAA coordinator for special issuance license for pilots that have had drug issues. In addition to that, I've helped write substance abuse programs and drug-free workplace policies throughout the country and actually throughout the world. In terms of treatment of opiate addiction, there are only a few ways to treat this. One is to do nothing in terms of medication and have an individual stop using opiates, go to AA, and hopefully stay better. This has a very low success rate. Secondly is to substitute, instead of opiates, using methadone. Methadone is a synthetic narcotic that is addictive, but is something that does not cause a high. An individual will go in every day to have their methadone dose, quite disruptive to an individual's lifestyle. The second way is using Suboxone, which is also a partial agonist, meaning that it partially reproduces effects by not letting an individual go through withdrawal, but not giving the same amount of high that a typical narcotic would. Individual buprenorphine, which is another word for Suboxone, use this, and this is a very common methodology. The problem is an individual remains addicted to Suboxone, at least at a certain degree. The third way is using a different drug called naltrexone, or known as Vivitrol. This is what we use. Once an individual has been completely detoxified and there's no longer narcotics in the system, whether the origin of the narcotics were injectable heroin from the street or people that were using pills prescribed by their doctor that are similar to narcotics such as Darvocet or Percocet, they have to be completely off the medication. Once this has occurred for 7 days, they will get an injection of naltrexone, otherwise known as Vivitrol. This is a blocker. An individual with this in their system, and it lasts for 30 days in the injectable form, cannot get high on narcotics. Even if they were taking narcotics to the point they depress the respiratory system, they won't get high. This is explained to the individual, and the amount of side effects is very minimal. Combined with the Vivitrol, however, one needs to undergo a very intensive program regardless of how we got into the medication-assisted part of it. What this means is a typical intensive outpatient program is 3 times a week, 3 to 4 hours a day of group therapy. In addition to that, one meets a counselor for an hour a day and a case manager also for an hour a week. On top of that, going to AA 3 to 4 or even 5 times a week for an hour or 2 hours at a time is essential. An individual goes through the intensive outpatient program anywhere from 4 to 6 months. It does take a big chunk of your life, but to be clean and change your life is important, and you won't be able to do it without this kind of intervention. We then suggest staying on the Vivitrol injections on a monthly basis for 18 months. If an individual does this, in our experience, we have almost a 70% 12-month rate of being drug-free. This compares to some of the national averages of 25 or 30% at most. We believe this is the correct approach. We believe it is good for companies and their employees. We believe it's good for society. We at Kevin Trangle Associates work with some of the top substance abuse rehab companies in the country. We have expertise in these matters. Please give us a call if you have any interest or want to know more.